Hey guys, I'm presenting my case today on non-alcoholic fatty liver disease. So a little background history of NAFLD. It's a condition where excess fat is stored in the liver and it causes pretty much no damage to the liver cells until it progresses into something worse. That's called NASH or non-alcoholic steatohepatitis. And that leads to cirrhosis. So, NAFLD is commonly seen in patients that might struggle with obesity, insulin resistance, or they may have elevated triglycerides or cholesterol. The treatment for this is pretty much weight loss, and that's done through calorie reduction, exercise, and healthy eating. And a way to achieve healthy eating is limiting saturated fat and carbohydrate consumption and the addition of healthier foods like fruits, vegetables, adding fish, nuts to the diet, stuff like that. So this patient, Mr. Mung Kim, he's a 38-year-old male. He is currently asymptomatic with no significant medical or surgical history. He does use tobacco and he occasionally uses alcohol. For his family history, his mother has diabetes and his father has hypertension and coronary artery disease. For the anthropometric data, his blood pressure is slightly elevated at 142 over 86. His height is 5 foot 8. His weight is 205 pounds, and his BMI is 31.1. So he is class 1 obese. For his nutrition focused physical assessment, it was found that he does have a firm liver, and the left lobe of his liver and spleen tip is prominent. The results for his ultrasound is pretty much what this means is that there's a loss of functional tissue in the liver, but they found no evidence of a tumor or stone in his liver. His gallbladder and pancreas are fine, and his spleen was found to be enlarged. His diagnosis is hepatosplenomegaly, which is the enlargement of the spleen and the liver, hepatic steatosis, which is non-alcoholic fatty liver disease, and evidence of hyperlipidemia and hyperglycemia. For his lab results, he did have elevated glucose, which this means he has a high intake of processed foods and carbohydrates. And also his body probably isn't utilizing the glucose correctly. He has an elevated ALT and AST, which is liver enzymes that show liver damage. So it is possible that he is in the stage of progressing to non-alcoholic hepatitis. He has elevated cholesterol, which is at 285, and anything above 200 is really increased risk for disease development. He has a low HDL and an elevated LDL and VLDL from all the saturated fat that he eats. Elevated triglycerides, which this is an increased risk for heart disease, and an elevated hemoglobin A1C. And that pretty much just means that he's pre-diabetic. So for his food and nutrition history, he has a good appetite, and throughout the day, for his work schedule, he either works day or afternoon shifts. And when he works the afternoon shift, he eats his big meal before going in at 3. So for his morning breakfast, he has coffee with sugar and milk. At work before lunch, he has pastry or a donut from the vending machine. For lunch, he has a sub sandwich or burger, chips or fries, pie or cookies, and soda, and this is all from the work cafeteria. For dinner, he usually has meat, 1 or 2 cups short grain rice, vegetables, kimchi, and usually some type of fruit. For his bedtime snack, he has chips, cookies, and popcorn. He has no known food allergies, and his wife also does the grocery shopping and the cooking in the household. So for the interventions for Mr. Kim, goal one is to reduce saturated fat intake, and this can be done by substituting out the morning pastry or donut. He can bring something convenient that he can fix the night before, like trail mix, a piece of fresh fruit. He can bring low-fat yogurt. Anything really that's low fat and nutrient dense is perfect. And he can also do that by packing his own lunch. Some days out of the week instead of eating the cafeteria food. And he can also maybe substitute the fries or chips with vegetables. Goal two is to increase mono and polyunsaturated fat and omega-3 intake. This can be done by adding fish to his diet, maybe one night out of the week instead of the meat, eat fish, or he can add some healthy snacks like walnuts, avocados, something like that. And goal three is to increase activity by 60 minutes. And eventually we want him to get up to 150 minutes a week, but he needs to accept that. So for the monitoring and evaluation, we definitely want to monitor the adherence to the new diet, his tolerance to the healthier foods, like the fish, nuts, whole grain products, fruits, vegetables, should be evaluated after 2 months of adherence. And this will determine if he's ready for maybe a stricter guideline. Also, physical activity should be evaluated if he's ready for increasing his time after 2 months. That's definitely something that should be talked about. And weight loss should be monitored, and lab values should be monitored again. Okay, thank you guys.